Okay, so hi everyone. In this video, we're going to be looking at the normal heart sounds. So if you put your stethoscope on your chest, what you should hear if you have a normal heart is two sounds, and we call this the lub dub. Dub 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 lub dub lub dub lub dub. This is the natural sound that you would hear, and the mechanism for this is not really understood. Some people say it's got to do with the closing of the heart valves, but what we do know is that the first heart sound, which we call S1, signals the start of systole. So if we recall, blood will enter into the superior vena cava, into the right atrium, and then into the right ventricle. Then you have the closing of the tricuspid and the mitral valve. Okay, so on the left side, you've got blood coming from the pulmonary vein into the left atrium, into the left ventricle, and then you have the closing of the right and the mitral valve. And that closing is thought to be what causes your S1, and that is obviously the start of systole, because when these two valves close, the ventricles contract, and that is systole. So S1 signals the start of systole, the contraction. Then, after the blood has been squirted out of the pulmonary artery, which is over here, and the aorta, which is over here, those aortic valves and the pulmonary valves need to close as well, so that you can prevent any backflow of blood from the aorta and the pulmonary artery. And that closing is thought to be referring to the S2, which happens to signal the start of diastole. So S1 signals the start of systole and S2 signals the start of diastole. But what's important to remember is that S1 is composed of the closing of the tricuspid and the mitral valve. S2 is consisting of the closing of the aortic and the pulmonary valve. So what we need to understand is that S1 has two components, the mitral and the tricuspid components, and S2 has got two components, the aortic and the pulmonary component. Now usually with S1, the mitral and the tricuspid component are the same time period, so we usually only refer to S1. However, S2, you do get what we call physiological splitting of the second heart sound. So remember we said that S2 refers to, according to current understanding, the closing of the pulmonary and the aortic valve. But what we know from normal physiology is that the pulmonary valve usually closes just after the aortic valve. And the reason for this is thought that because the pressure in the pulmonary valve, pulmonary circulation is much lower than the systemic circulation, when blood goes from the right ventricle into the pulmonary artery, it's going to take a bit longer because the pressure is lower, which means that the pulmonary valve is going to close slightly later because the blood is moving perhaps at a slower rate than in the systemic circulation from the left ventricle. So therefore, what we would normally expect is that with the second heart sound, you would have the aortic component, and then just after, you would have the pulmonary component. So you would have a slight splitting of the second heart sound. And this is physiological.